Georgia is making strides when it comes to addressing mental health. The state investing more funds in treatment. Joe Ripley following this story for us. He says, it's a good start, Joe. Nonprofits are saying, though, more work needs to be done.
Yeah, and let's not underestimate the strides that have been made, Dan, when it comes to putting mental health care on par with physical health care with the Mental Health Parity Act. You've also got the investment, like you mentioned, in schools and law enforcement when it comes to those crisis response teams as well, taking more of an emphasis on making sure mental health is addressed. As we know, it affects so much of the rest of our lives. Spoke with one nonprofit, Chris 180, who has served 20,000 people the last year alone. They particularly focus on kids and teens facing homelessness. That number might sound staggering, and it is. It's only a sign that the prevalence of mental health care needs is there, and it's only growing from here. Chris 180 provides mental health support, foster care, and adoption services for youth facing homelessness. President and CEO Katie Stone calls it a lifelong battle.
It is a challenge. The good news is that we are talking so much more openly about mental health and how it plays into overall well-being.
Stone says now's the time to take treatment a step further.
What we do now is make sure that the access to services is keeping up with the additional awareness about the need to focus on mental health.
Stone says she's seeing more demand for services now that folks are talking about mental health more. She adds meeting that need can't just fall on nonprofits alone.
It's not a one-size-fits-all solution, which is why you have to have a myriad of support available for them.
Georgia passed the Mental Health Parity Act, adopted the 988 hotline, and funded more mental health care services in schools. Stone says Chris 180 embeds counselors in 86 schools across the metro. Stone says addressing mental health oftentimes starts with addressing economic issues, lack of housing, and food insecurity, and that affects whole communities.
Because it's not just about the individual. When you're there to support them, you're also then having effects on their families and the community as a whole.
Marks May 1st, and May is known as Mental Health Awareness Month. Stone, you heard there, she urges all of us really to take care of our mental health, especially if you're a primary caregiver. She says those folks tend to neglect their mental health needs most, get a little busier, and sometimes burn out just that much more quickly.
Chris 180 is the name. I'm looking at their annual report here, really details a lot of their successes. Last year, and you kind of talked about this, they helped more than 250 unhoused young adults, and they not only helped get a roof over their heads at one point, but they helped 29% of them obtain employment, which really sets them on the right path.
Yes, it does. And I hope you stay tuned tomorrow because we do have a story on people with criminal backgrounds getting back into the workforce as well. But it just goes to show you the holistic approach that's being taken by foundations like Chris 180, and it goes to show that whether it's economic issues, lack of housing, any other struggles really pour on when it comes to mental health. So it's key to address those factors first, and then the mental health you will see will follow from there and improve. It's something we've also been tracking last month or so, the Atlanta Women's Foundation study that had come out, and it noted particularly women impacted by poverty are twice as likely to struggle with things like anxiety, depression, and burnout, substance abuse too, because there may not be better ways that they know of to handle those mental health issues. And so 11 Alive Investigates also did a report. Rebecca Lindstrom had a great report on the enforcement of some of these laws that Georgia's put on the books in trying to address mental health, like the Mental Health Parity Act, but it's fallen short in some regards. $25 million in fines announced for some of these companies that have not held their word up and have not provided the providers necessary, resources necessary to meet those mental health needs and demands.
More work to be done, no doubt about it. Joe, thank you, sir.